Jane Chung.
Hi.
Hello. I'm Dr. Giam. What can I do for you today?
Hello. Quite simple really, I just want an MRI scan of my brain.
Okay. Could you tell me why you feel you might need one?
Well, I've been having some quite worrying symptoms. It's just on my face and it's always on the same side.
Always on the left?
That's right, on this side, and it's really painful.
Could you tell me how it all started? Just take me back to the beginning.
It started about 4 weeks ago.
Okay.
I was having, I was feeling a bit run down, to be honest with you. I had some flu symptoms, like sore throat, and I was feeling really run down. And then as I was recovering, one morning I woke up with this pain. And to be honest with you, at the beginning it wasn't too bad. It kind of comes and goes. It wasn't too bad at all. And it was in the last week, it just suddenly got really, really bad. And it's just really horrible pain. It's just there.
And is it there all the time now over this last week?
All the time. It doesn't go away at all.
Can I ask you some specific questions just with regards to it? You've
Sure.
mentioned it's just on the left side,
Yes.
nowhere else at all.
No.
And is it just here? Whereabouts on the left side is it exactly?
Worse around here. It would go up here, and it goes down just behind
Into
here
the
as well.
jaw, okay.
And to be honest with you, it's like one of the worst pain I've ever had. It's
dear.
really bad.
How would you describe the nature of the pain? Is it sharp? Is it?
It feels like my face is on fire. I mean, it's really hot and burning. And sometimes when it hits you, it's so sharp.
Yeah.
It's awful.
And when you actually touch your face, is it tender?
It's very tender, yes.
So it's actually tender when you sort of feel around this area.
Yeah, when I do that, it really hurts.
Have you noticed anything else that brings on the pain at all?
When I brush my teeth in the morning, that's really bad.
Oh dear.
When I eat, every time, basically when I have any kind of jaw movement, it tends to bring it on.
I see. So this must be really interfering with things.
Yeah, it hurts every time I eat.
Yes.
I just, I lost my appetite now. I just don't want to eat anymore.
Just a few more specific questions. Have you noticed any headache at all?
No.
Any problems with your vision?
No.
No blurry vision? No double vision?
No.
With the left eye in particular, any redness?
No.
Any watering of the eye?
No, not that I know of.
Any weakness with regards to the face?
No, I haven't noticed.
Arms, legs, all okay?
Not yet, thankfully.
Okay, okay. And have you taken any painkillers at all? Any pain relief for this?
Yeah, I tried paracetamol. I also tried Nurofen. They don't work at all. They just don't touch it. I mean, normally painkillers work really well, but they just didn't do anything at all.
How frustrating. I mean,
Yeah.
you've mentioned obviously it's been affecting when you're eating, brushing your teeth. How else has it affected you, for example, work?
Well, a couple of days ago I had to take time out because it was really bad, and I took time out today again, because I had to come and see you. I just want to know what it is. I mean, I'm just so worried because this is like, it just came on just like that, and then it's been there all the time, and the painkillers don't work.
I mean, I can understand it's very frustrating, and you mentioned that you're worried, of course. Was there a particular worry that was going through your head?
I hope it's not what I think it might be, but my mum passed away 2 months ago, and she had a brain tumour, and to be honest with you, she was diagnosed late. Well, that's how I felt anyway, and I remember very clearly my mum had symptoms on one side of her body, and she's got some funny things going on her face as well. I mean, I hope it's not, but I mean, these things run in families. I mean, I don't know, so that's why I thought, an MRI scan.
To get yourself checked out.
Yeah.
Well, I can see where your concern comes from, and I'm sorry to hear about your mother. Just a couple more routine questions, if I may, Jane. In terms of work, what is it that you actually do? You mentioned you've taken a couple of days
I
off.
work in the local library.
Okay. Okay. And do you smoke at all?
No.
Do you drink?
No, I don't drink.
I haven't got you on any regular medications right now, is that correct?
No.
So other than the paracetamol and the ibuprofen, you haven't tried anything else at all?
No, and I'm normally really well. I mean, I rarely ever come to see you, to be honest.
Sure. So just to recap, 4 weeks ago, pain to the left side of the face after you've been feeling a bit ill with a bit of flu.
Yes.
It's been getting worse over the last week.
Yes.
You're obviously concerned as to what's causing it.
Yeah.
And whether possibly it might be something serious like a brain tumour.
Yes, I hope not. But
I understand. I promise I'm going to readdress that for you. Before I
Okay.
do, if I could just do a quick examination, and
Okay.
then we'll get back to that. Okay?
That's fine.
If I could just take you behind the examination. Yeah?
Thank you.
We'll start off by doing your blood pressure. That's great. I'm going to examine the nerves around your face. Firstly, if you could just open your eyes for me. Okay? Screw up your eyes now. Blow out your cheeks. Show me your teeth. Stick out your tongue. Just wiggle it side to side. I'm going to have a look into the back of your eye now. Thank you. I'm just going to test the sensation to your face. Close your eyes. Say yes when you feel me touch you.
Yes, 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 yes. That really, it's really
It's
sensitive on
I'm
this
sorry
side.
about that. I'm just going to do a quick examination of your arms
Mhm.
and your legs and just your reflexes. That's great. Come on back.
Thank you.
Well, Jane, having examined you, having listened to the story, I know your main concern was it a brain tumour or is it a brain tumour? I'd like to reassure you at this point, I really don't think that's the case. Okay?
Oh, right, okay.
I know you thought you mentioned brain tumours run in families. They don't generally, in fact.
Okay.
And usually a brain tumour would tend to present with other sorts of findings in the history, like a headache or the sort of whole-sided weakness that your mother experienced.
Yes, she had that.
You don't have any of those things today.
No.
And reassuringly, your examination, other than the tenderness around your face that you described, was actually normal. So
Oh, really?
I'm quite
Okay.
confident that a brain tumour is not likely. And I know you mentioned an MRI scan. I would say at this point, I don't think that's necessary.
Okay.
I don't think it's a brain tumour that we're dealing with here, and I don't think an MRI scan would necessarily be helpful at this moment in time. Okay?
Okay.
However, obviously these are symptoms that are quite frustrating for you, that I can see.
So what's wrong?
We need to try and get it better, absolutely. Well, what I think's wrong is that possibly you've got an irritation of the nerve that supplies the face, something called the trigeminal nerve, and this can sometimes happen if you've been a bit more run down or had a recent viral infection.
Okay.
The good news is there are plenty of treatments that we can offer you to try and get it better, and I don't think this is something you're going to have for the rest of your life. Okay?
So what do I have again?
It's called trigeminal neuralgia.
Okay.
That's the condition
Right.
that we call it by.
Okay.
Now, you mentioned you've been taking some paracetamol and Nurofen. It's not really helped. What I'm going to suggest is this. There are some medications that are a bit more appropriate to trying treating nerve type of pain.
Right.
So I'm going to suggest that we try one of those today, if that's okay.
Okay.
It's called carbamazepine,
All right.
and it's a tablet that we often use in treating epilepsy, but we often use in treating nerve type of pain, such as yours as well.
I don't have epilepsy.
You
do
don't
I?
have epilepsy, no.
Okay.
What I'm going to suggest is this, Jane, that we try you on a small dose, one tablet twice a day, morning and evening. We see you in a couple of weeks to see how you're getting on with it.
Okay.
How does it sound as a plan to you?
There is side effects with the medication.
Well, that's a good question. I mean, with this particular type of medication, the only side effect you need to be aware of is that sometimes it can interfere a little with your blood count. It's a rare side effect,
Okay.
but side effects that you need and symptoms that you need to look out for if you get any sort of sore throat or rash, very important to stop the medication at that point.
Right.
What we would routinely offer you is just a blood test to make sure that your blood count is normal, and we would do that after you've started it in a couple of weeks.
So not today?
Not today.
Okay,
Not
right.
today. So if I give you a prescription today, do you think you would be okay trying it out, seeing how you get on with it?
Yes, but I mean, is it something that will last? I mean...
I'm quite confident that we can get this better.
Okay.
But obviously, if it's not improving with the sorts of treatments that we're offering you here, we can always consider referring you on to a specialist.
Okay.
But I'm quite confident we can get it better.
Okay, that's
Does that
good.
sound all right?
Yeah, that's a relief
So
actually.
let me just do the prescription for you now.
Okay.
Okay, so it's carbamazepine.
Yeah.
It's one tablet twice a day,
Okay.
and I will see you again in a couple of weeks. See
Okay.
how you're getting on.
That's brilliant.
All right,
Thank you so much.
no problem. Bye now.